Hi, everyone. Good day to you. Welcome. My name is Abalonia Levitt, and I am from Levitt's Itty Bitty Delivery. It's my private practice. It is a MULA practice, doula slash midwife. I'm currently studying to be a certified professional midwife, and there's different paths for everybody. And as you all know, there are several different types of midwives. You'll find that if you're in your path to becoming one. I've also joined the evidence-based birth, and I'm learning so much daily that I just wanted to share what some of the things that I'm learning as far as what is the evidence-based information when it comes to water births, eye ointments, placenta encapsulation. The list goes on and on and on. And if you go and look at Rebecca Dekker's information, a good resource is YouTube. And I love the videos on YouTube and the podcast, as well as Facebook. You can kind of learn a lot about that and get a grasp on what the program is and what evidence-based information actually means. So this information does not substitute for a care provider-patient relationship and should not be relied on as personal medical advice. Any information should not be acted upon without professional input from one's healthcare provider. Now, with that being said, let's dig into it. I'm not really used to doing a lot of live videos or recordings or things like that. I'm more of an in-person type, but I'll get used to it. So bear with me if I kind of ramble or stutter or things like that. I am human. I'll get better. And okay, so I want to talk about the evidence on water birth. And I have a quick summary that asks questions. It gives the evidence, and then it kind of just asks, what do professional organizations have to say about this? And then the bottom line. So that's the summary of basically what I'm going to talk about. So let's get started. So some of the questions are, what are the benefits and the risk for water birth for mothers and babies? The available research shows that water birth has many benefits for mothers. Evidence has also shown that babies born in water have similar outcomes compared to babies born on land. However, the evidence is not strong enough to look at the rare adverse effects or potential long-term benefits or harms for water birth. The evidence in 2017, researchers pooled 39 studies and compared to over 12,500 hospital births, nearly 16,000 hospital land births, There was no differences in any health outcomes, including NICU admissions, APGAR scores, breathing difficulty, need for resuscitation, infection rates, umbilical cord pH, or low body temperatures between babies born in water or on land. The largest randomized trial to ever examine water birth was conducted in 2013 at a hospital in Iran. 100 people were assigned to water birth and 100 people were assigned to land birth. They found that fewer people assigned to water birth had cesareans compared to those assigned to land birth, 5% versus 16%. People in the water birth group also reported less pain with labor compared to the land birth group. There was less meconium in the mother's amniotic fluid with the water birth 2% versus 24%, and fewer lower APGAR scores. So the largest observational study ever on water birth, and the first to report results from the United States, included over 6,500 water births attended by midwives at home and birth centers. For mothers and babies, water births was associated with fewer postpartum transfers to the hospital and fewer hospital admissions. However, during the first 6 weeks postpartum, the people who completed the water births were also the ones at lower risk for health problems. There were no differences in newborn death rates or APGAR scores between the water and land births. For unknown reasons, they found that mothers who gave birth in water experienced a small increase in mild labia tears. Other researchers have found a decrease or elimination of episiotomies, which means cutting of the vaginal wall with scissors, with water birth. Also, they have also been restricted by, I believe, ACOG to cutting, doing episiotomies underwater. So having a water birth did lower the risk of episiotomies, but some doctors would just drain the water out of the tub as soon as they thought the baby was going to come, and then begin to perform the episiotomy. So what do professional organizations say about water birth? The American College of Nurse Midwives, the American Association of Birth Centers, and the Royal College of Obstetrician and Gynecologists in the United Kingdom all support water birth as an option for healthy women. The American Congress of Obstetricians and Gynecologists, ACOG, came out with a strong statement against water birth in 2014. In 2016, they updated their opinion statement to state that their potential risks have not been sufficiently studied to support or encourage a person's request to give birth in water. They continue to recommend that birth occur on land, not in water. However, they acknowledge that the maternal benefits of water immersion during labor and support informed choices and more research on water birth. That is an awesome thing, because you got to think 2014 and 2016, that wasn't very long ago, and we have been giving birth since the beginning of man. And when we start putting protocols in place, we need to also reinforce protocols that make sure that protocols keep getting updated and reinforced. So what's the bottom line? The bottom line is that water birth is a reasonable option for low-risk birthing people, as long as they understand the potential benefits and risk. If women have a strong desire for water birth and there are care providers who are comfortable attending water births, then at that time there's no evidence to deny the option for pain relief. So with that being said, as long as you can find a care provider who is willing to be there and support you during that time and take on that responsibility, there's no other evidence to deny this option, especially as a method for pain relief. I hope that helped. Join me for more information. I look forward to providing you with more information. If you have any questions, feel free to message me. And yes, have a great day.